Welcome back to our first episode of 2026. I can't believe we're already on our 4th month of doing the podcast. We all hope you had a lovely time over the holidays, and I'm here today with my co-host Veronica to talk to you about health literacy. Hi Veronica.
Hi Megan, how are you?
I'm good, how are you?
Yeah, very good, thank you.
Did you get anything nice over Christmas?
I had some lovely Christmas presents, and I know it sounds a little bit like a cliche, but when you get to my grand old age, it's more the spending time with the family and just having that relaxed time with everyone. What about you, Megan?
Perfect. Yeah, I also enjoy spending time with my grandparents because, they're getting up there in age, and so it's always nice to see them when we can. I did mention last episode that I was hoping to get a hot pot grill combo, and I did, and it works beautifully. I had a lovely hot pot meal with some friends over the new year, and it was very well worth the pestering my parents to get one for.
Oh, that's good to hear. I'm sure your friends were very grateful to your parents as well.
They were indeed, especially when I managed to get salmon from the family fish and chip shop, so that also helped.
Very good. Very good.
So obviously, as we know, January is the month of health literacy. So for those that might not know, can you explain what health literacy is?
Yes, we like to use the definition that was provided a few years ago by the US Department of Health and Human Services. And I'm going to actually read it out to make sure that I get it correct. So they say that personal health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others.
So really, it can be simplified to how well our patients understand the information we're providing to them when related to their health, and how easily they can find reliable health information. So with that in mind, we thought this was the perfect month to explore how health information is shared within and beyond the NHS. After all, we all know that libraries, whether NHS or public, play a huge role in helping people find trustworthy, understandable information. So we thought, who better to chat with than our lovely colleagues over at the public library who help people find good, reliable information every day. So I'm happy to say, hi Alex and John, we're really happy to have you on the podcast today. Thank you for making time for us. Can I start by asking you to introduce yourselves and a little bit about your respective roles?
Yeah, absolutely. Hi, my name is Alex. I'm a development officer within Somerset Libraries, and I focus on our health and wellbeing offer. So, you may not be aware that nationally, libraries have a number of different outcomes that they deliver on, and one of those is health, and it covers many different things that I'm sure we'll talk about later. And my job is basically to plan new initiatives and roll them out across our libraries in Somerset.
Hi, I'm John. I'm John Carter, Senior Development Officer for Somerset Libraries. Similar to what Alex has said, and is what we're trying to make sure that we can deliver those commissioned outcomes. My job often is about trying to bid for money in order to develop the projects that we can then roll out, and some examples of which you'll hear about later.
That's lovely. Thank you both for introducing yourselves. So, to start us off, can you share with our listeners how the connection between our two library services first came about and what inspired us to begin working together?
Yeah, sure. So it was probably about 8 years ago. It was a connection you had, actually, wasn't it, John? And you connected with the NHS library here at Musgrove, and she came over and set up a health information display for us for Health Information Week, just kind of highlighting some key advice around where to get trusted health information, what to trust, what not to trust, key websites to go to, that kind of thing. So this started off as a display initially, and then your team offered to train our library staff, and that was really key, actually. So that meant that our library staff then had the skills they needed to support people with finding the right health information. Because obviously we have lots of books, but increasingly people are going online for health information. And the training that you gave us meant that our staff could then support the public in making sure they were getting their health information from trusted websites and kind of helping them to identify misinformation and that kind of thing.
Yeah, and it was actually you, Veronica, I think, that did all of that, wasn't it?
I took over from Siobhan. You first had a connection with Siobhan, my predecessor, didn't you? And then I took over in 2021.
That's right.
So, yeah, so we've been working together for 5 and a bit years now.
Yeah.
That was great.
Perfect. So obviously you mentioned that there is a wide range of health offers. Could you talk about some of the key services that are available right now?
Uh, yeah, we've got loads of different ones. So increasingly, public libraries have been working with the NHS and with public health to support their offer because there's that realization that in the current economic climate, we can achieve more together. So we support each other in initiatives. So we kind of tend to take our lead quite a lot from the NHS and public health, don't we?
Yeah, I think there's a key aspect that libraries are very well recognised now, especially by our partners, as safe, welcoming spaces. And that's a huge selling point for them because it means that they can then also deliver some of their services in an area where the public feel comfortable and safe.
Yeah. So some of our kind of key partnership projects that we've been doing over the last few years is that we loan quite a lot of different health equipment. So we loan blood pressure monitors out of all of our libraries in Somerset, which is 30 libraries.
32.
32 libraries. So that's completely free. You need membership, but it's free to join. We also have activity tracker watches. So they do everything you'd expect them to do, measure your steps and distance run or swim or whatever it is that you want to do, detect your sleep, that kind of thing. But we have those at 16 of our libraries, and again, completely free to loan. We also loan iPads, which have their health benefits because we have particular health ones which are preloaded with health apps, which Veronica supported us on to make sure that those are really trusted um, apps that people can use. We have baby weighing at all of our libraries. So that was a partnership with public health to enable health visitors to have more time to deal with other things. We do NHS health checks in 6 of our libraries. So that's Taunton, Yeovil, Glastonbury, Wells, Chard and Porlock at the moment. But the list is getting bigger. So if you're eligible for a health check, you can now come into the library for one, as well as going to your local GP. We have stand-on health monitors in 6 libraries, which measure weight, height, BMI, blood pressure. We also have static blood pressure monitors for anybody who would rather use a sit-down one. And then, of course, we have our books, lots of specialist health collections. So, yeah, all sorts now. I think that's everything.
Yeah, I think the key thing with the books is that they're actually chosen by health professionals. So they are curated, is the key word I think we like to use, because increasingly it's becoming important that people can access reliable, curated information, whether that's books or online. Libraries becoming seen as a key element to that.
Yeah, like a safe space for it. I remember growing up and would always go to the library to sort of like back out a book after school, or even in terms of them moving on to a student and having libraries as like a safe study space. And I think they've always been a really key part of my life, definitely. But I think they are such a key part in a community where you can get that trusted element with trusted peers. And there is something to be said about the fact that librarians are considered one of the top respected and trusted professions. Um, so people might not realize just how much physical activity and well-being support now takes place inside of a library. So we've spoken a little bit about obviously the blood pressure monitors and the well-being support that you guys have. But I also know that you run some physical activity sessions. So can you talk a little bit about that and which libraries currently host them?
Yeah, so this was a sort of a new area for us a few years ago. We'd done a lot in the way of kind of, reading for well-being and that kind of stuff. We'd never tried physical health groups. So we kind of gave it a go. It was a bit of a gamble, wasn't it? We didn't really know if it was actually going to work. That was about 3 or 4 years ago, and it went really, really well. And we now have it in 4 libraries, so Taunton, Bridgewater, Frome and Yeovil. We work with an organisation called Nova Sports who are based around Frome area, and they specialise in disability sport, and their coaches deliver activity sessions in our libraries aimed at anybody with a barrier to doing physical movement. So that could just be because they're older, it could be an injury, it could be a disability. anyone who just kind of wants a low impact approach to exercise. But the biggest thing about them is that we just try to make them fun. So we have a kind of range of different sessions, so it changes each week. So we do bocce, we do yoga, indoor tennis, curling, and we also make use of our interactive equipment. So in libraries, we've got interactive projectors where you can kind of walk all over stuff from the floor. We have Nintendo Switch, we have virtual reality headsets, so we make use of those as well to make movement really fun, and it's really successful. And we have regulars who've been coming for groups for a really long time. It's a crucial part of their week, both for the sort of mental health benefits and the physical health benefits. Um, so yeah, they've been sort of a surprise success, really.
Yeah, the feedback has been incredibly positive. I mean, we've had people saying it's literally life-changing for them. Sometimes because they were so lonely and they didn't have anything, and this gives them something to put on the calendar and people they can meet. Some people because they found some physical benefit that they just couldn't get otherwise. One lady even said to me that for her, going to one session gave her more benefit than going to a physio for months, because she had somebody who had the patience, time, and that could spend some time with her to show her some exercises and some tips. So yeah, it's been a really powerful thing actually.
We should say, as with everything at libraries, it's all free as well. So we get it through external funding.
Yeah, that's amazing. I think there is something to be said about, especially during COVID and that loneliness and not being able to go out. And I think there's a real big shift at the moment about community and people getting together, not only for the physical benefits, but also that mental health aspect and being able to meet people who are in probably a similar situation. And, like you said, being able to mark something on your calendar once a week is a great way. So obviously we've talked about we have briefly mentioned the iPads with the approved NHS apps, but there's a real focus on the digital health literacy at the moment, so people being able to understand the information on the apps and presented with them. So what has the response been from the library users about having those accessible iPads in the libraries?
Yeah, really good. I mean, John can probably talk a little bit more about the importance of our digital offer. So alongside our health offer, we also have a digital offer, which is about making sure that those who don't have access to digital technology or the internet, whether that's rurality or because of financial barriers, can access that. So that's where the iPad loaning came from, didn't it?
It did. I mean, I think really there's two aspects to this. There's people with device poverty. They may not have an iPad or a phone or anything like that at home. So it gives them a chance to, if you like, get on the ladder to start playing with these things and to build some confidence. Sometimes it's data poverty. So for some people, they might have a device, but they just can't afford the data. One of the key aspects to the loanable iPads is they come with a SIM card part of it. So they don't have that issue. They don't even need to have Wi-Fi at home. So that's been the feedback we've had. So a lot of people have meant to them, it's been able them to build that confidence and to start using the internet, even doing things like online shopping and getting reliable information and just feeling more confident. And the other thing to mention is a lot of our libraries have tech help sessions. Again, these are completely free, where people can just come along with their phone or iPad or anything else. They might have had a present from the grandchildren of an iPad that sometimes happens. They don't even know how to turn it on. So they can come to the tech help sessions and they can support them and literally walk them through very patiently about how to set up emails or how to then access information safely. So these sessions have been really valuable for people as well. And I should even mention you can get people that don't have access to SIM cards can even get hold of a free SIM card in libraries through the Good Things Foundation scheme that we're part of. So that's another offer that we're able to, which has been particularly useful for the displaced community. So refugees, asylum seekers, etc., sometimes have been able to make use of the free SIM cards as well. So it's quite a wide, broad offer that we've been able to develop over the last few years.
Yeah, I think there's a lot more that goes on in libraries than just a place to borrow books, and I think sometimes people aren't aware of the scope of even just help and benefits that they can get for free at a library. So obviously we've spoken a little bit now about the digital offer that you guys have. And I believe that you're launching new promotional videos, including one that's centered around the library's health and wellbeing offer. So could you talk about what the aim of these videos are and what you hope the public will take away from them?
Yeah, we're quite excited by these. We've just launched the films. There's an event actually at Bridgewater Arts Centre tomorrow, but we'll be pushing them out on all our social media channels. So we've had some external funding, and with this, we've been able to produce these films, which are primarily for social media. But what they do is they showcase some of those hidden gems, if you like, that people may not be aware of, including all the things that Alex has mentioned. But we've had some within the films, we've had some amazing feedback from customers, which is why they're so powerful, about people saying how the positive impacts of the services they've been able to access. What we're hoping is that through seeing the films, that people will actually then come into the library they may not have been in for a while, and they might not realise all the things they can now offer, and then they'll come and join the library again. And we just hope then they can share the videos with other people and friends and family, so they can also. So basically, there's 4 films. One is based on health, as you say. Another one is based on people looking for employment or job seeking or building a business. There's another one aimed at parents and carers of very young children, and another one aimed at teenagers. So those are the 4 key markets, if you like, that we've been trying to reach out to with these films. They can all be found on our social media channels. So everyone just searches for Somerset Libraries UK on Facebook or Insta. And also they're available through YouTube and on our website. And the website to look for initially is glassboxtaunton.co.uk. And then you can access all of the films from there. And then we'll be gradually building more short clips from these films out on social media to highlight some of these key offers. So watch this space.
I'm excited to watch them actually, because I know when we've spoken previously that you guys are really passionate about them. And I will make sure to pop the link in the description so people can
Great.
go directly there as well. So looking ahead at what future collaborations we see between our libraries, I know that there's going to be a wider rollout of the NHS apps coming up. So did you guys have any thoughts about that?
Yeah, that's kind of the biggest project we're working on, and it's great to be on this podcast because it is an NHS partnership. So this is a national initiative where NHS are partnering with public libraries across England, um, so that libraries can support more of the public to access for NHS apps. So I know this is a big part for NHS's 10-year plan, and libraries are an integral part of that. So what it will basically mean is that we'll kind of gradually roll it out in Somerset, starting with the biggest libraries and going out. And it means that the public can come in to the library and get support with getting the NHS app set up on their device or setting up an NHS account on a desktop, and also learning how to use all the different functionality that comes with that. So it may just be that the staff can signpost the public to helpful videos, or as John mentioned, we do have these digital drop-ins in a number of our libraries. So that means that members of the public who maybe need a little bit more one-to-one support in being able to use this kind of technology can get that. So they will need to make an appointment. It's not going to kind of be open access, come in and get it help whenever you want, but we do want to be able to offer the public that support that maybe, GP practices and pharmacies just don't have capacity to offer that one-to-one support. We're hoping to be able to kind of help fill the gap a bit there.
I think some of these pharmacists and GPs are also saying they'd like to come into the library to then give people that support as well. So I think, again, it underlines this growing awareness that libraries are that safe, welcoming space, that some people who may have a little bit of a barrier even going to a GP surgery, they're not going to have that same barrier about coming to the library. So again, we hope that that's going to grow.
Yeah. The health offer in libraries sort of really grew much faster after COVID, and I don't think that was a coincidence. I think as people kind of looked for more health support in sort of non-clinical environments, they moved into libraries for that help. And yeah, as the partnerships between the different organisations have developed, that's kind of turned into a really successful offer.
Yeah, and I think it's a growing movement, especially when you look at the sort of the big 3 shifts with the NHS and the 10-year plan and sort of things going towards, prevention and people being able to be treated at home and having that support in a trusted space that they can get access to without then having to worry about going into a GP in a clinical setting, because sometimes that's not the right environment for the question that they need if they just have a generic question that they want to answer.
Yeah.
Um, so thank you both very much. That was really insightful, and it's definitely been lovely having you on. I'm now going to pass back over to my lovely co-host Veronica, who was going to be talking about our reading corner.
Okay, thanks, McGann, and thanks, Alex and John. It's always been so great to work in partnership with you, and I mean, it's just great to see the success rolling and sort of cross-sector or in cooperation. And hopefully we can keep building on that. So I'm going to talk on the theme of health literacy and providing sort of clear, patient-centered information. I'm going to highlight 2 books, both authored by one of our amazing consultants here at Musgrove Park, Dr. Lucy Pollock. The 2 books that she's written are the book about getting older for people who don't want to talk about it, and The Golden Rule. And I've honestly lost count of the number of times that I've recommended these books to people, or indeed actually gifted copies of these books to people, because they're just... Lucy Pollock is basically the sort of doctor that we would all love to have as we get older, and she has a unique ability to convey her expertise through storytelling that's really accessible to all readers. So I think these books are helpful to anyone, whether you're working in healthcare, whether you're a patient, whether you're a family member of someone who's getting older, or simply someone who's getting older yourself. And let's face it, we all come into that category, some of us, myself, more so than others. So the book about getting older celebrates longevity, explains how the final years of life can be lived positively, and is really helpful to anyone who reads it to help you get started having the necessary conversations about what's important to everyone as they get older. And I think that's something that's really lacking. And I know it probably ties in with another offer that you have in libraries where I know you have sort of death cafes where you do encourage people to have sort of difficult conversations. And I think both of these books by Lucy Pollock help you understand how you can start having those conversations with your family. I honestly wish these books had been available when my own parents were reaching that stage of their lives. They weren't available then, but I'm going to jolly well make sure that my children read them when that sort of time comes. But both of these books, obviously they're available in any good bookstore, but they are available from the libraries in Yeovil and Musgrove Park hospitals, and they are available from your public libraries. And as well as being available in physical book form, you can also borrow them for free from the public libraries through the Borrow Box app, where I know that you can find these books both available as ebooks, and the book about getting older is available on Borrow Box as an audiobook actually read by Lucy Pollock herself. So, having mentioned the Borrow Box app, I'm now going to hand back to McGann, who's going to tell us a little bit more about it.
I decided for this resource of the month that we would highlight a resource from our public library, BorrowBox. So this is a free app that gives you access to a whole world of ebooks, audiobooks, magazines and newspapers, and all you need is just your free library card. It's like having your library in your pocket. Easy to use, available 24/7, and perfect for reading or listening on the go. So you could be after the bestsellers, children's books, or curated themed collections. BorrowBox makes discovering your next read simple and seamless. That really does sound like an ad for it, doesn't it? So all you need to do is download the free app, sign in with your library details, and you can start borrowing straight away. Does that sound like a good pitch for
Sounds
borrowing?
Good. I think the thing that a lot of people don't realise is that they can access magazines and newspapers through the Borough Box app as well. A lot of people have been able to access loads of things they just couldn't afford otherwise, which
Yeah.
is fantastic.
And I think even if you can afford it, it's one of those things that is just so accessible that people just don't realize that, it's just an app on your phone, which a lot of people have apps that they don't use. But I think this is one that I know myself, and I think we've mentioned, Veronica, that we use quite frequently, I have to
Yeah,
say.
I use it all the time, and I would really encourage people. I think this is the thing with public libraries, and I certainly was guilty of this myself for a large chunk of my life, that I thought, well, I can afford to buy books, or I can afford to buy audiobooks. I don't need to go to the public library. But I think actually what we all need to understand is that public libraries are there for everyone, and actually the more people who use them, whether you can maybe afford to buy the books yourself or you need to borrow them, the more people who use them, the greater their profile and the more good they can do as a community for people who really genuinely, that might be their only chance to access those resources. So I have made it my mission over the last few years to use the public library as often as possible and to encourage others to do so.
Yeah. I think it's worth saying on Borough Box as well, we have promoted it within Musgrove as well, haven't we? Because when you have patients who are, lying in bed for a long time without much to do, audiobooks can be, a real sanity saver.
Yeah. Yeah, that's very true.
Yeah, I probably should have downloaded it on my grandfather's phone when he was in hospital last year, because I think he definitely had those periods of, when you haven't got family visiting and you haven't really got anything to do, it does drag on a bit. So now we're on to what I might consider one of my favourite parts, apart from having our guest speakers on, is our research spotlight. So I'm going to pass back over to you, Veronica.
Thank you, McGann. So, again, with reference to our special guests today, I want to highlight the impact that even small pilot projects can make, and the impact that they can have, and the sort of cyclical nature of research. So I took part in a small pilot digital health literacy project with John and Alex, which took place in the first half of 2023, where Somerset was one of 14 pilot sites around England, where partnerships between NHS librarians and libraries from other sectors investigated different methods of delivering digital health information to their local users. So that pilot only lasted for 6 months. It only had a very tiny amount of funding, but I know that we gathered some useful, rich information from our project here in Somerset, and that was the same for all 14 of the pilot sites. The results from all of those pilot sites were amalgamated and analysed, actually by myself and 2 other NHS librarian colleagues as part of a research course that we were on at the time. And I'm aware that the learning that was gained from those pilot projects helped inform some further development of the NHS app to make it more accessible for end users. So now we're sitting here having this conversation, talking about the new NHS app initiative that's being rolled out across public libraries across the country. So I just think it's a really great example of how what seem like very small steps can lead to meaningful change. And Alex and John, I just wondered if you wanted to add anything else to that.
One thought, it's a great opportunity to highlight the potential in libraries for research projects, because we know from what we see every single day how impactful library-based initiatives can be on health outcomes. But what we would really love is some evidence and some papers that prove that, and hopefully ensure that funding continues to go into these kind of projects. So yeah, that's kind of the biggest takeaway from what you've done and from what we continue to do, is that the projects are great, but they'd be even better if we had some researchers interested in them. So if there are any listeners out there who are interested in sort of public health-based initiatives and community-based health initiatives, then do get in touch with us, because we would really love to work on those kind of things more in the future.
Yeah, absolutely. And I don't think it's an underestimation to say that Somerset is actually regarded as one of the leading authorities in the country when it comes to the health offer and the partnership with NHS and public health. Um, but we just want to see that grow, and we want to see it grow even further, partly for our own benefit, but also so we can share some of that learning throughout the country so that other authorities can hopefully then replicate and do things which we know are very impactful and have a massive impact on people's lives.
Yeah, that's great. And we're all about mobilizing knowledge and learning from experience. So yeah, again, I will emphasize what you've both said, that if there are any of our listeners who want to get involved in a research project in connection with our public library staff, then please do get in touch, and we're going to make sure that we put contact details in the show notes.
Thank you, Veronica. I think we've had a really nice discussion today, and it's been really great having you guys on. Did you have any sort of like closing thoughts that you wanted to share?
Oh, I suppose really a kind of a call to action for your listeners, if that's okay. Really, what we'd like to say is please join your library service. Join Somerset Libraries. It's free. It's easy to do. You can even do it online if you want to. Just look at our website, somersetlibraries.co.uk. Take a look at our social media channels because of the films that I've mentioned and many other offers that we now highlight through those social media channels. So just look for Somerset Libraries UK on any of the social media platforms. But crucially, go and visit your local library, and please go and become a member. Or if you're a member that's lapsed, we welcome you back.
And I think one note to add to that call to action is, if you are sort of like dealing with patients, know to signpost them to the health offers that the library has. Tell them about the offer that the public library has, and encourage them to sign up as well. It's all free, and like you said, there are 32 libraries around Somerset, so there will be one that will welcome you with open arms. So thank you guys for listening. It's been great to have you both on for our 4th episode.
Thank you for inviting us. It's been a pleasure.
Thank you.